good to have you here. And we're now on record for this time of training and time of working together and getting some really useful strategies that you can implement into your day in 2, 3, 5-minute time slots, because we know it needs to be doable. Okay, so we're going to introduce ourselves very shortly. We're going to go through what we're going to run through tonight, and we are wanting interaction along the way, as we already said, so that would be awesome. So make sure you know where your chat box is, make sure that you ask questions along the way, respond to what we say when we're asking you to think about things, and put some answers in the box. So are you all here with us? It's a webinar, so we can't see your wonderful faces. But are you all here with us? Let's give it a go. Type in the chat box if you're here online, ready to go. Yes.
Boom, boom, yes.
Excellent. Hi, Naomi. Fantastic to see you. Hi, Louise. Hi, Fiona. Hi, Justina. Luke, Zara, Melissa, Catherine. Awesome. Annette. It's all coming in. Fantastic.
If we don't say your name, it's not because we don't like yours, it's what names are going too fast.
It's fantastic. So we've got hands raised as well. Awesome stuff.
Awesome.
Fantastic to have you on here. We are really thrilled to be here to give you this information, to give you this strategies to put into place, because information without action is just a whole pile of stuff that just sits there and doesn't get activated. So we're all about taking action. Okay, here we go. Yes, we are a burst of energy. That's what we do. So hold on to your socks, and here we go. Right, so I'm going to bring up the slides and we're going to get underway. Fantastic. Okay, so preventing burnout and looking at how to promote positive mental health. Absolutely vital for every single person across this planet. And incredibly vital for you amazing people who work in healthcare, you nurses and beyond. I'm not sure if there's care workers or anybody else in here, but all of the people who are on here and listen to here, our hat is off to you. You are amazing.
Hell yeah.
What you do and how you care for people in our communities is incredible. Thank you, thank you, thank you. So let's just start with that. We are from WALT Institute, and we'll introduce ourselves a little bit more. I'm Elizabeth.
And I'm Christine.
So we will talk a little bit more about who we are in a minute. So we want to think about this whole topic of stress and burnout. It's not a very nice topic to necessarily think about on a Tuesday evening at 7 o'clock or wherever you are across Australia, whatever time span it is. But it's really important because we know that it's on the rise. We know that burnout is on the rise, and we need to proactively manage this going forward, because it has a ripple effect on everybody we have contact with, doesn't it? It absolutely does. It has a ripple effect on our families, our teams, and society as a whole. So we need to work out how we can do a different approach in relation to the relentless demands that are happening in the world at the moment. All the uncertainty, all the stressors, all the different normals. There is no normal anymore. What is the new normal today might be a different normal tomorrow. And we need to be able to be adaptable and flexible with that, because we need to be resilient. And that's next week's topic. So if you haven't booked in for next week's topic on Wednesday, we're back on Wednesday. So we're looking at some simple strategies tonight that will arm you with the tools to stop that downward spiral, because there is a way to do it. We don't want to keep on going down and feeling like we're losing traction and losing the ability to cope, because that can lead to burnout, as I'm sure many of you have seen in other people around you. And hopefully you're not in that downward spiral too far, but even if you are, these strategies, when you implement them, will absolutely work. Okay, this is proven evidence-based strategies based on positive psychology that we know works. We do it ourselves every single day. That's why we're a burst of energy. We do it with our coaching clients that we work with and coach, and everybody that we interact with, whether it be the person making our coffee from the takeaway coffee, because we're not quite at cafes yet in Melbourne, but nearly there. So we're wanting to arm you with these amazing positive strategies to prevent burnout, promote positive health, and it's like having that maintenance. How often do we take our car to maintenance? Often 6 monthly or 12 monthly. Yet we sometimes forget about ourselves. How often do we make sure that this thing doesn't get too low?
Yep.
That we plug it in. We keep the batteries going. We keep the updates happening on our computers. But do we do that for ourselves? Or do we forget about ourselves? And so what is the implication of that? And how do we do that going forward? So that's what we're looking at today, to be able to make sure we can maintain and tweak and improve wherever you are at right here, right now. Okay? Sound good? Let me know if you're still here. You're still on here?
Yep, over here.
Let me know. Okay, cool. Now, Jeremy reminded me that it's Occupational Therapy Week this week, and as an allied health professional myself, we have to say Happy Occupational Therapy Day. Week. Happy Occupational Therapy Week. So let's get underway. Cool. So today we're going to look at defining burnout. Now, you're probably very aware of this, but I just wanted to make sure we're all on the same page to get underway. Yep. And we're going to look at our responses to chronic stress. So what are they? Are you aware of them? Do you know where you're at the moment and what's happening for you? We're going to look at self-talk and our beliefs around this whole thing of burnout and responses. And then we're going to give you 6 steps that you can implement in 2, 3, 5 minute stints to improve, to maintain your mental health, to prevent burnout. Sound good? Cool. Perfect. Awesome. So just a little quick snapshot of who we are. I'm Dr. Elizabeth Pritchard, and I'm a health professional. As I said, I'm an occupational therapist, researcher, and also leadership coach. And I've coached over 700 leaders and researchers and professionals, Australia, New Zealand, and internationally. Published internationally in peer-reviewed articles and also in Thrive Global. And I have over 3 decades of working in STEM. And I have these amazing professors, mentors who are Professor Paul Wood and Ronnie Wood, who help guide us through the world of STEM and science, particularly in technology, and help grow us and sort of challenge us along the way of what we do and how we do it. So I really encourage you, if you haven't got somebody like that, to make sure you do and have somebody in your side supporting you along the way. We've worked with places like the Hudson Institute of Medical Research, WALT Institute, Monash University, and many, many others. And this is Christine Burns, and she comes with us with an amazing background in relation to sport and sports psychology. So Christine is a former elite athlete, New Zealand hockey, and she also captained the team. And so her ability to understand teamwork, to understand how to get peak performance in whatever situation you're under, no matter how extreme the situation, no matter how extreme the environment is, she has these amazing ways of building these strategies and moving through it forward and going forward. She's managed a national program in New Zealand of exercise science and sports psychology. We have the same mentors, and she's coached individuals and teams for over 20 years from New Zealand School of Dance, Royal New Zealand Ballet, Rugby League, Hudson Institute, Bionics, and many, many others as well. So this is what we bring to you today. We bring our 2 worlds coming together to give you these strategies that you can implement straight away. So we're going to give you a heads up. In case you hadn't noticed. In case you haven't noticed, we can get a bit excited. We love doing what we do. We know these strategies work. We have proven them over the last 4 years or so that we've been working with clients, and we do it for ourselves every single day. We get animated because who wants to sit here and listen to people talking about a situation or a topic for 90 minutes at the end of a day on Tuesday? That would be really boring, wouldn't it? Yeah, so we don't do that. Okay, heads up, we may swear. That's just what we do. If we do, that's okay. You've been warned. Yeah. We're not here to tell you how to do your job. You do your jobs amazingly. You are the experts in your jobs, in your fields. Absolutely. We're not here to blame the system. Nah. Because what can we do about the system? We can influence the system and we can say, hey, no more. And we can stand up for things that we stand up for or stand against. But we cannot blame the system for where things are at. So that's not productive, not useful. So we're not going to do that. What we are going to do is, I've said about 3 times already, we are going to give you simple, proven strategies that absolutely work. So let's define burnout just to make sure we're all on the same page. So the World Health Organization identifies it as a syndrome, conceptualized, as you can read, as resulting from chronic workplace stress that's not been successfully managed. So we're looking at the chronicity of it. So it's not just something that's a one-off. Often people go, oh, I had burnout last week and I just needed to stop working for 3 days and I had to just look after myself and watch movies and eat shit food and sit under the blankets and I'm good now. Let me say this, that's not burnout. Burnout is chronic workplace stress. It's got an extended time frame to it. And because of that, it's a little bit more insidious. So we need to be really careful of our language. If we're having a really tough time, a really down or blue time, then let's say that. Let's not leap our language to burnout, depression, and all of those other big, huge words, because as you'll see as we go through, what words we use link to how we respond. And it links to our mental health in a huge, huge way. That is one of the keys that we're going to talk about coming up. So 3 dimensions that the World Health Organization has identified. It's about energy depletion or exhaustion. And I guarantee that many of you on here will feel this at some degree, to some degree at the moment. It's about increased mental distance and also cynicism. So it's really hard to engage in things. It's really hard to get really inspired about things. It's really hard to go, oh, what do I need to do here? How can I make decisions? Because we get that increased mental distance for that chronicity of stress. And then we get reduced professional efficacy. We worry about, oh my gosh, I don't think I'm very good at this. I don't know what I'm doing. I really can't do this. It was like, oh, I'm not sure what to do next. And we start second guessing ourselves and our confidence starts going, and we're not sure what to do and how to do it. And that just feeds more and more of this feeling of isolation and exhaustion and cynicism, and it just keeps on going. So that's where we're coming from today. So there's been a few studies, there's been something like 35,000 studies over the last 7 months of COVID-19 when I did a quick search yesterday. And there's a couple that I think is just sort of relevant just to set the scene. You probably know this already, and if you're experiencing it, you totally will know it and you don't really care about the numbers. However, I think there's a couple of things that are important to note in here. So there's this cross-sectional study that was done by Kanampalil, and I'm not sure if I said his name right, Thomas, his name's Thomas. And what they were looking at is they investigated physician trainee stress and burnout. So it was a study done in the US with 1,375 people, and they split the groups and and they looked at, one of the groups worked with people who were being tested for COVID-19, and the other group worked with just normal people in the hospital setting. And then they looked at, they identified where they were in levels of stress, burnout, and if there were any changes or differences. And as you can see up here, the difference between the group that were working with those being tested. Now, this is not even working with people who were diagnosed with COVID. This is not working in ICU. This is not working in that extreme cold face of where probably many of you nurses are working or have been working. So this is just linking with those people who are being tested for COVID. And you can see the differences between 29% and nearly 19%, for burnout between 46% and 33%. So working in a place that we perceive as risky and unsafe does things to us, does things to the way we perceive and how we roll forward with what we do. The second study was done in Australia, Australian healthcare workers, and they're both done this year recently. And when they were looking at investigating psychological distress in Australian healthcare workers during the pandemic time. So they were looking at how the healthcare workers rated themselves on anxiety, post-traumatic stress disorder, and burnout. And these were the factors around here. And they identified for themselves that they showed moderate to severe depression, 1 in 5 had anxiety, 1 in 4 PTSD, 1 in 4 was experiencing chronic stress and burnout. Now, these are quite high. When you compare these to the national average, which I checked with in relation to last year's figures, they are higher than that. So they're between 5 and 12% higher than they were last year. And there's no way that we can doubt that this whole thing of the pandemic, the whole situation of the uncertainty across the whole of the world, let alone just the health system. It impacts everything, as we know. There's all of these restrictions in place and curfews, and you can't go out of the country to go and see people who may be living in other countries. And so there's a whole lot of stressors that we must acknowledge and recognise. However, the beauty of this and what we're going to go through tonight is that we can do something about this, okay? So hang in there, we're getting there. So responses to chronic stress, they can be physical pain, and that can be in any part of the body, particularly headaches or gut, back, neck type problems, gut digestive problems, cognitive fog and fatigue. So again, that's that factor that we talked about before, where you can't actually recognise what you need to do or how you need to do it. So you've got that mental distancing, and that can lead to cynicism, lack of concentration and tension, feelings of despair, disconnection, emotionally numb or emotional. So there can be either side of that conundrum there. And often it's about wanting to leave. It's like, you just need to get out. It's like, I just need to get out. So that may be wanting to leave your work, maybe wanting to leave your relationships, wanting to leave the children when you're school parenting for 3 months at home. And it's like, you just want to leave. And so it's not good for the industry. It's not good for the companies. It's not good for individuals. So we need to do something different about that. Now, it's really important to think about awareness bringing change. We can't do anything about what we're experiencing unless we're really aware of it. So what I want you to do is to type in the chat box what responses you recognize there for you at the moment. So let's just be honest with ourselves and let's just take this little moment of reflection. It's like, what responses are you actually identifying in yourself right now that I've asked you? Just type in the chat box and just put 1 or 2 or 3 things in there. Because if we're not aware of how we are responding right here, right now, then we can't do anything to change it. So be brave, jump in the chat box. Most people are in the same place. What are the top 2 or 3 things in there for you that you recognise?
And there's nothing in the chat box.
Nothing in the chat box. Are you still awake? We're still there? As I said, awareness brings change. If we don't have awareness...
Here we go.
We go. We're looking in the wrong place.
Backache, concentration gone, confusion, fatigue.
Cognitive fog, confusion, yeah. Yes, we're here. So there was 2 different places to look in here, and we were looking in the wrong place.
Fatigue.
Awesome. Fatigue, lack of concentration.
Affected,
Yep. So I'm not saying these things for you to feel bad. I'm not saying for you to go down the dark hole of Alice in Wonderland.
No.
I'm actually bringing this up because when we recognize these, then we can do something about them. And how exciting is that we can do something about them? Awesome. Thank you for your honesty, and thank you for recognizing, because we know that the personal cost is pretty huge. Because if we don't do something about this, then it decreases our performance overall. Like you're saying, your concentration and your fatigue and all of that, it will decrease our performance overall. It actually stops our focus. We're unable to focus, a bit like this picture beside it. It's like it all gets a bit blurry, and we can't make decisions. It's so hard to make decisions. And it ruins our personal connectivity because we're grumpy buggers. and it's like, sometimes we're just not nice to be around. And so what do we have to do about that? It can destroy our creativity and innovation because we just don't have the energy to be creative. We don't have the energy to be innovative, and it saps our energy big time, and it impedes ongoingly our decision making. Okay, so that's all the bleh. Okay, the rest of tonight's different. We needed to recognize this, because if we don't recognize this in ourselves and our colleagues, then how can we make a difference? How can we make a decision to do it differently? Because where we're at right now is based on what we've been doing up till now. And if we don't make a change, and if we don't decide to make a change and do it differently, then we will stay in the same conditions. So it's not about the conditions that shape our lives, it's our decisions. And it's up to us to make a decision that I'm going to do this differently, and this is where I'm going to go from here. Okay, so one of the first things that we need to recognize is that our thoughts create our reality. Now, let me just sit on that for a minute. That's why it's so big. Our thoughts create our reality. Now, you might jump in here and go, my thoughts didn't create this pandemic. My thoughts didn't create the lack of PPE. My thoughts didn't create the way that we've been treated over here. My thoughts didn't create the useless amount of blah over there. My thoughts didn't create the policies over here that allow us to do this or don't allow us to do that. Correct. However, remember, we can't control what's out there. We can control this. The only thing we can control is what's controllable, and that's us and me. So the thoughts is the first place that I can control. And we're going to give you some hints around this to show you how, okay? Because what we focus on, we get more of. I'll say that again. What we focus on, we get more of. And if we focus on all the negative stuff, if we focus on the fatigue, if we focus on the confusion, if we focus on the mental fog, if we focus on the system, if we focus on their fault or that person or that one, then we get more of it. Law of the universe. And so our thoughts create our reality. And we're going to take you through how to change some of those thoughts and set yourself up for a different outcome. We cannot change the situation, but oh, good golly, Miss Molly, we can change our response. In fact, that's the only fecking thing that we can change.
Yep.
Is my response to the situation. I cannot change what's out there. I cannot change the pandemic. I cannot change the way that swabs are taken from here or put through, delayed in the lab. I cannot determine what happens over here in this situation or that one, or who's holding on to the PPE gear or any of that thing, in any of those things. But I can change my response to the situation. And you might think, yeah, whatever. Stay with us. Stay with us to the end. We will give you these principles and strategies that you can put in place, and it will stop that spiral, and you will be able to build this thriving, amazing awesomeness of yourself within the broken bubble. Okay? So this is how we can do it.
Cool. So here we go. What I'll do is just fling that there, and hopefully this wants to move. Maybe slide might go. You can keep tapping on that. Right. There we go. So what we want to take you through for now is just that whole idea of what can we do? What can you do? And what we've identified here is we've labeled it as sanity, just so that way it's really cool, little acronym that you can hang on to. Now, it's that thing of how do you get it, and then how do you keep it? Because there are those moments that, few and far between, it probably seems at the moment, of going, oh my gosh, whew. And there might be a little ray of sunshine. There'll be that little thing where you're like, feels good. Oh shit, here we go again. And it can be that roller coaster. So the thing that I really want you to start thinking about is what can you do in those moments? So how can we grab it, and then how can we keep it? So that way, when you start to take control of the controllables and go, you know what, I'm going to own this. I'm going to get more out of this where I possibly can. And so this is the deal. These are the 6 things that we want to go, okay, how the hell can you grab more of it? Because we want you to be able to identify that thing where you can grow from this. We want you to be able to learn from this, and we want you to be able to grab hold of it and hang on to that sucker no matter what. Easier said than done, I know. Happy to admit that, all right? But like Elizabeth said before, it's that thing that's got to be kept maintained. You know, we look after these cool little things like friggin', you know, we charge that sucker. We're like, oh, I need to do the next update. Oh, I want a new phone cover. Oh, I want to do this. You know, and we tend to worry about our phones or our cars or things outside of us, but we want to jump in here as well. Top 6 inches and in here. So the thing that we're going to take you through is this acronym of sanity. So we're going to look at scan and notice. We're going to call things as is. So if it's shit, it's shit. If it's awesome, it's awesome. We're going to look at new ways. So we're going to look at those new ways of doing things, new ways of doing life. Now, that's not like the massive big picture. It's the things that you can control. But instigate new habits. Now, those are little habits that you can get your finger on, little habits that you can do in those 20, 30 seconds, 5 minutes. Not talking big stuff, okay? Because there's no way that is going to jump into here for you in this kind of space at the moment. It's talking about think differently. Now, this is the concept of not rearranging totally your top 6 inches to go, hey, wow, let's just think in a totally new way. No, it's been able to identify those little bits and pieces and go, you know what? How can I just tweak that thought that I had? Or how can I have a different intention in this situation? Little things we can pop in. And then that last piece there is totally where you are worth it. So the big key first to look at is this whole scan and notice thing. Now, what we want to do is it's not this whole thing like going, okay, let's just pause for half an hour and see where I'm at and sit and cross-legged and for a wee while and see what's going on. It's not that kind of stuff. It's that thing where you
Even though that's really useful.
It is useful. If you got time, do that, by the way. But it's that thing of doing, just check in, you know, and the whole point of check in is that I'm absolutely positive there's, you know, people external to you. There's someone, something, there's stuff going on outside of you all of the time. All right. You start that shift and bang, it's external. Hearing that. The thing when we talk about check-in is that we're able to go and just for that moment, pull back into here. Just for that moment to come back into ourselves. Instead of being controlled by everything out there, feeling like someone else has got the remote control, and I'm sure it feels like that at times, it's that ability to, in your top 6 inches, go, what if I just scan and notice? I can just check in. Where am I at? What's going on? What's happening for me right here, right now? And you've just gone, dunk. Like if you were to do it right here, right now, and just pull yourself just back into yourself. So instead of looking at the screen, instead of listening to everything else that's going on, just go, just back into you. Are you sitting down? Are you standing up? Are you lying on your bed? Are you lying on the floor? Have you got a cup of tea, cup of coffee in your hand, water in your hand? Are you eating? And yes, I have just paused on purpose. It wasn't the screen that froze. It's just that thing, just back into you. The thing then is to do a quick body scan. Now, this is just going head to toe, toe to head, whichever way you want to do it, your choice, all right? I'm not going to tell you how to do that. But it's just that thing. Are you feeling any tension? Are your shoulders up around your ears? You know, are you carrying something really tightly and not meaning to? Are you know, what is going on? Is there those gut problems that are starting to happen? Are you finding that you've just got something going on and you're just like, hang on a minute, where am I at? Just do that quick body scan. And again, it's that thing to pull you back in, and it's just that moment to pause, to go head to toe. Where are we at? What's going on? And it just slows everything down for that moment. It just eases off. Work out which emotional state you're in. Now, you're not about to sit there and go, how am I feeling right now? It's just label that sucker. What's the emotional state that you're in? You know, are you feeling excited? Are you feeling frustrated? Are you feeling angry? Are you feeling amazed? Are you feeling surprised? You know, what is it? Or are you just like, meh, where are you at? And you're just putting that ability to go, what emotional state am I in? Where am I at? Again, it just pulls you back in here and just eases off. The words that you use, what are the words in your head? So right here, right now, you might be going, man, these guys are amazing. This is really cool. I'm loving this. This is freaking amazing. Look at those slides. Wow, that's awesome, mate. Or you might be going, oh, I could be doing this, I could be doing that. What are you doing? You know, and it's these little things that get you to just pull back in. What's going through your top 6 inches? Is it positive words? Is it negative words? Are you labeling things out there and complaining about what's happening out in front of you? The things you can't control, the things that you are not able to control. You're only able to control the controllables, and that's you. And then also have a look at the environment that you're in. Is the environment absolutely pumping fast, or is it really calm and quiet? You know, are there a lot of people around? And in that moment, I might be like, you know what? If I can take the next 30 seconds just to move away from all of that busyness, you might still hear it, but if you don't have to see it just for that few seconds, you can just take yourself away from that. So have a look out the window, big breath in, release it off, and then go back to what you're doing. You're controlling the controllables. You're taking control of that situation to be able to do what you can in that moment in time. I'm loving this technology. You can push the next one, Tara. So when we look at scan and notice, and I'll keep jibber jabbing as we go, is you want to be able to identify what your state is. Now, when you identify what your state is, the reason that I'm saying this is because if you're really stressy and frustrated and you find that you're really pumping at a high level, everything's going to be shit and frustrated and pumping at a high level. It's all going to reflect how you're feeling. You know, those days when you're like just going, zoom, 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 this thing, that thing, I've got to do this and I've got to do that and I've got to do the next thing. And someone comes in and goes, oh, I was just wondering, can you help me out? No, I can't, I haven't got time. Whoa, that's what's going to happen. But if we're able to just pause for those, scan and notice, I'm starting to get wound up. Okay, cool, just ease off. What can I do? I can look out the window, I can breathe, I can control this. And then you just pull back a wee bit. And it's not that we're about to tell you to calm down, because when in history has ever telling someone to calm down ever actually calmed them down? But it's when we're in that state of being slightly eased up, or when we're in flow, we see things differently. We have a different perspective on life. And that's where we want to get to. Pull back into you, into the internal world, so that you've got control of the controllables. Instead of being controlled by everything out there on that remote control, and that having control of you. The next thing you want to do, and this is the coolest one, because you get to call it as is, as it really truly is. If it's shit, you call it shit. And if that gets bleeped out, then that's nice. It's those things, it's that thing of just call it as it is. What is the meaning that you assign? Now, this is not anybody else. We could be sitting here going, oh, it's not too bad. It's okay. That might not be the same thing that's going through your top 6 inches. If you're like, man, this is ridiculous, this is just frigging crazy, then you call it frigging crazy. You're allowed to do that for yourself. Because if you push all that shit down and you're like, oh, well, I suppose I can't say anything, I suppose I just have to get on with it and suck it up and carry on. You know, that tension, that stress that goes on, those headaches, that gut problem that you have, all of that, it's going to keep coming back. Label that sucker. And it's not that you have to walk around and tell everybody how shit it is. That's you know, just label it yourself. And then, right, okay, cool. And then what's really happening? What is really happening? So you're allowed your nano tanty, all right? Throw your toys out the cot, whatever it might be, have your nano tanty, label it as is. The shit is shit, if it's awesome, it's awesome. Whatever it is. Label it, have your nano tanty, and then recognize it for what is really going on. When you're able to pull back. Or is it absolutely crap? And you go, you know what do I need to do here? Acknowledge that you are in that moment. And don't bullshit about it. There's no pretense, all right? You call it as is, because the thing that you've got to make sure that you're doing is you've got to be able to recognize for what is actually going on. When you're able to recognize what is actually triggering you, and it's not that you're always going to be able to stand and go, Now, the reason I'm feeling all tense is because, no, it's an ongoing thing that will have occurred. But in that moment, with no blame, no shame, no judgment, and no guilt, if you're able to go, you know what, that situation that I just had to deal with over there was absolutely ridiculous. That has just flicked me off. Okay, cool. What can I do about it? I can have my nano tanty. I've labeled it. I can freaking call it everything I like under the sun. I can remove myself. from that situation if I can. If I can't remove myself from the situation, I have to go, you know what, this is really starting to push my button. This is fucking not good enough. What can I do with this? Can I deal with it at this point in time? No. So you might have to choose to park it. You might have to choose to grab it and put it back over here on the shelf and grab it later. You might have to choose it and go, you know what? I'm going to grab the talkie stick and I'm going to put it in my back pocket and I'm going to come back to it later. Because if I deal with this stuff right here, right now, it's not going to go well. Or right here, right now is not the place or time to deal with it. I need to put it on the shelf or I need to put it in my back pocket and I'll deal with it later in the right space at the right time. The way you can start to do that is when you're able to start identifying new ways, when you do things differently. And this is when we start to look at things. If you keep doing something the way you've always done it, you're going to keep getting the same results. You know, that's called insanity. So what we're looking for is sanity. We want to change it around and go, you know what? How can we get a different outcome here? I can control the controllables. Therefore, I might get a different result if I do it in a different way. Think about those things that have worked for you in the past and then go, hey, how did it work? Why did it work? What was I thinking? What was I doing? I could use that here. And again, it's you taking control of what you can, because you can't control the remote that someone else has got, but you can start going, you know what? I'm the CEO of this sucker here. I can control the controllables. And so if we want a different outcome, we have to do it differently. We have to start taking ownership of it. And when you identify it and think about it, is that you are where you are in your life right here, right now, because of all the decisions and all the thoughts that you've ever had. So you are where you are in your life right here, right now, because of all the decisions and the thoughts that you have ever made. Now, those are the shitty ones as well as those awesome, amazing ones. When you go, oh my gosh, I'm going to do this. Bingo, look what happened. Not doing that, I'm going to do this. As hard as that might be to decide to do this and go this way, I'm going to friggin' well do this. And look at what it gave you. These are the ways to start thinking about things. If you do it differently, you get different results. And this is where we have to start looking at, because you've got to think about, what am I doing? It's not working. It's not serving me. It's not serving the team that I'm working with, and it's not serving anybody else that's around here. Stop it. And I know that sounds harsh, but it's got to be that point. Just stop it. Change it. Do it differently. What worked for you in the past? What harebrained idea can you come up with right here, right now? Because what we're doing is just shifting. You go, I'll take the talkie stick back, thanks. We'll come up with a new idea in here, and bang, we're going to do this. When you start doing that on a consistent basis, do it with things around home. When someone says, do you want a tea or coffee? Do it differently. Do something different. Go somewhere different. If you're in Melbourne, you've got plenty of places to go now. You know, it's those things of do things differently. Start making those decisions so that you can have different habits. And what you want to think of is do things where possible. And I'm not telling you how to do your job. Where possible is to do things with a single task focus. Can you zone in and do that particular task and then finish that off? And yes, someone might be calling you to go and do another task, and that's cool. And you can hear that and go, yep, cool, coming. Finish this task. Finish there. Right now, I'll go and do that. And that moment allows you to finish that single task and go off to another single task. These are the points that are going to have the biggest impact on being able to get you to be comfortable with being uncomfortable, because you're taking back control. You start to recognize that you're able to do things a little bit differently, and you're starting to recognize that you're actually able to switch things and move things around. The key things are here for you to be able to start doing things in new ways. Now, when you scan a notice and you go, what's going on for me? You call that sucker as is. If it's awesome, it's awesome. If it's shitty, it's shitty.
When you start thinking about it and you go, you know what, I can do things differently, because you're now coming back into here. You're now slowing things down and you're now easing up. You're going, hey, I can do this differently. I could do this in a different way. And right at this point, if you keep heading down that same pathway that you're going, then that's where you're going to end up. You're going to get more of what you're doing. If we go, okay, you know what? I'm going to draw a line in the sand. I can't control what's out there. I can't control the external side of things, but I can start controlling my internal world. I can do things differently. Recognize that you have to do things differently. And it starts in here with you. It starts with your top 6 inches. And this is where we start going, okay, this is really uncomfortable. This is awkward. This is weird. How do I change this? That means that you're doing it right. When you start getting that little bit going on in your top 6 inches, like, that's where you've got to go. That's where you've got to start making some of these changes. We do it by instigating these new habits. And when we're able to instigate these new habits, what we want you to do is do things with purposeful intention. And you need to do it consistently. Now, when you're able to have those little moments and go, you know what, when I go into that particular situation over there, this is how I'm going to go in there. You might not end up in there the whole way through. You might not come out in that same intention. You want to go in there with that intention to go, right, here I am, right here, right now, with that single task focus to go, you know what, here's how we're going to work here. This is what's going to happen. Here's my intention for this situation. And even if it's just for you to have that clarity in your top 6 inches, for you to go, you know what, I'm going to stay as focused as I can and get my ears on, my eyes on, and everything else on. And I'm going to make sure that I'm fully present and I'm going to do the best that I can right here, right now. I'm going to bring the best version of me forward at this point in time. Now, whether that's 50%, whether it's 100%, whatever it might be, if you're at 50%, then that action that you give consistently for that moment is 50 out of 50. If you're at 90%, you give 90 out of 90. Wherever you are on that scale, because you've called it as is, yeah, you know what? Feeling it like bloody 25 right now, give it 25 out of 25. Call it, do it consistently and have that intention, because then what you're doing is you're being true to yourself and it's aligning with your values. If you go in there BSing yourself going, oh my gosh, I'm running out. This is ridiculous. This is such a stupid place. Yep, you're calling it as is. This is a crazy situation. This is ridiculous. Oh, and now I have to give 100%. No, you don't, because you're BSing yourself. Call it as 25 out of 25. If you're feeling at 25%, go, you know what? You're going to get 25 out of 25. Be honest with yourself. And when you do that and it aligns with your values, you are totally setting yourself up to thrive and flourish, because you're being true to yourself. When we get that aggravation, that's when we're not being true to ourselves. Now, yes, it can be super challenging. It can be really, really tough to have to do this. But this is this thing about being comfortable with the uncomfortable. And this is your choice. You want to make choices, not be reactive and responsive to everything else that is happening out there around you. And this is when you take back control of the controllables. You take back hold of the talkie stick and you go, you know what? I'm the CEO of this. And I'm going to deal with it at whatever level I can give it. And if it's at 75%, I'm going to give you 75 out of 75. And then we'll see what happens after that. Yes. And that's cool. Now, you will fall off track. Not when, it's not if, it's a matter of when, all right? It's not if, it is when. So you got to have that little plan in place. Have your little plan of going, what's going to be my little thing that I can do to be able to get myself back on track? Now, if you're in those situations and you're like, you know what, this is absolute bollocks, this is whatever's happened, whatever it might be, maybe your thing that you have is that you go off and you get a drink of water. So you remove yourself from the situation, you go over there, whether it's in your drink bottle, whether it's from the tap, whatever it might be, you go, right, how can I get myself back on track? What do I need to do? I'm going to go back in there and I'm going to have a new way of doing things that you've set things up. So maybe you've got a little mantra in place. Maybe you've got something that you say to yourself because now you've got new ways of doing things. Maybe you've got this ability to go, you know what, if this is just, I'm going to call it as is, and this is just ridiculous, and this is crazy, and I need to do something differently here. I've checked in, I've gone, right, I'm feeling okay about this. Right, let's get back in there and give it the best that you've got. Now you need your cues and your triggers around to be able to do this. So you want to attach things, whether it's the fact that slightly different but same. I always use this pen when I'm doing any of these, even in a workshop face-to-face, those were the days. Even when I'm doing anything, I use this pen because I love the feeling of it. And it's the kind that you can use on different devices as well. I really like it. Had to change the ink filter inside of it, the refill. But you know what? It's that thing is that I know that when I grab this, I'm like, it's all good. It's all in control. I've got this. And I can little tutu with it. Tutu, Maori word for play, right? Kapai. So I can play with it and I like the feeling of it. It's really solid pen. So I'm like, it's really solid. I'm solid. It's really cool. I can keep doing this. And then I'm back out there and I do it. Now it can be as simple as that. If you've got a pen in your pocket, and it can be the thing like, you know what? Solid, it's cool. Got this. I can do this. Bang, bang, bang. Right, let's go. And it's these little things, you know, it can be simple little triggers and cues that you use. And the key thing that you need to do is celebrate. When something goes awesomely well, you friggin' well celebrate that damn thing. You're like, yes, right? And even if that's on the inside, because yes, sometimes you can't jump around the ward going, woo, because people wonder what the hell you're doing. But it's that thing of like, celebrate those damn things, whatever it is. If something has a reason to celebrate, you friggin' well celebrate that thing. It flings off all your happy chemicals. You get that little double whammy inside your body, and your body gives you that nice little hack, and it goes, you know what? You're smiling and you're getting excited about something. So I'm going to send all those happy little chemicals your way, and you get that little kick. All right? You get it for free pretty much by going, yes, and it sends off those happy little chemicals. So you need to celebrate. And these are the things to make sure that you're doing is to go, you know what? I'm going to think differently. Because when you think differently about things, you have a totally different perspective. And so in that T of sanity is to go, you know what? If I use constructive self-talk instead of beating myself up, because would you talk to your friend, your loved one, your kids, your colleagues, the way you talk to yourself sometimes? And I bet you're sitting on the other end, you're like, oh, no, nah, you wouldn't. All right. So when we think about these, is choose the constructive self-talk. Give yourself a pat on the back every now and again. You're allowed to. It's really easy. You lean forward, you take whichever hand you want, and you put it on the opposite shoulder, and you do that. And you tell yourself how cool you are, because you are. And these are the little things. It's like, you know, instead of going into a situation going, this is going to suck, this is going to be so hard, this is going to be terrible. Might not be. Might be awesome. But if you go in there and go, you know what, instead of me sitting in the negative self-talk, at least if I come to neutral, because sometimes you can't always get to the awesome and amazing and really cool and positive, because, you know, sometimes things are not like that right now. So we have to be real, call it as is, and go, you know what, if I put myself up to neutral, at least I'm not beating myself up. I can go, you know what, we're going to do what we need to here. We're going to get through this, and I'm going to give the best version of myself that I possibly can. I'm going to make sure that I keep everybody else going, that we've all got each other's back. And sometimes that's all we can give at that point in time. Yeah. And that's cool.
Absolutely.
It's better than going, this is going to be shit. Oh, that was dumb. Oh, that was so useless. Because when you do that, like Elizabeth said right at the beginning, what you focus on, you get more of. And if you keep saying that things are shit and terrible and horrible and useless and a waste of time, you're right. But if you go into those situations going, you know what, we're going to get through this no matter what, and we're going to get a good outcome, or we're going to get the best outcome that we possibly can in this situation, I bet you do. And if you go into that situation going, you know what, let's go for broke here, man. Let's just pump it. Let's just have some fun. Let's go and do something cool. It will be cool. Yes. So we want to have a look at what it is that we're saying to ourselves. What are those phrases? What are those words? What are those things that we're saying to ourselves? Are we setting ourselves up to be optimistic? You know, because you don't always have to be happy, clappy. Oh, yay, because this is bullshit, right? What you want to do is have a look at that thing of being neutral. And then if you can go, you know what? let's just make the best of it. Let's just go and do something positive that we can in this situation. And you will have read it. This third bullet point. No one makes you think anything. This is your choice. No one makes you think anything. You know what? Like, I could influence you here and go, in the last 24 hours, what was something really cool that you did? Like, whether it was just having the best coffee, the most amazing dinner, finishing shift and go, woohoo! What was the most amazing cool thing that you've done in the last 24 hours? Throw it in the box, put it in your little chit chat box. What's the coolest thing that you have done in the last 24 hours? What is it that you have done? Throw it in your chat box, please, and tell us. What is it that you have done in the last 24 hours that is amazingly cool? And we're going to see if we can find it. And I still can't find anything, but that's okay, because I'm sure that you're writing amazingly cool shit, and that's all good. And I'll leave that up to you to find it. Disappeared on us. So, but I bet you're typing amazingly cool, awesome things. Complete a workout challenge. Yeah, boy.
Yes.
Even better.
Awesome.
Worked really hard and went to aqua aerobics. Oh, how good would that be?
You had some time out.
Sewed more face masks. Hey, wicked.
Brilliant.
Sleep after night shift. You gotta love that, eh? I worked for Wellington Free Ambulance for a while back home too. Pretty cool. So,
Time with your dogs, had a nap. Awesome.
freaking awesome, people.
Awesome.
Now, what has just happened is that we're going, last 24 hours, I did this, it was cool, is this? Some of you have probably got a smile on your dial. Some of you are like, man, that was pretty cool. Yes, I influenced you, but I didn't make you think anything. What we did was went, positive, little shift. Think differently. That's all we did. Now, your thoughts impact your feelings and impact your actions. So when you have those things in your top 6 inches, return to the gym for the first time. How friggin' cool is that? The smell of the gym, for the first few times. It's kind of cool. So when you think of these things, you put yourself back into that situation and you're like, man, that was really cool. You might turn your ears on, turn your eyes on, turn your nose on, all those things. You're like, wow, how cool is that? And you're in that moment just for that moment, that time. These are the things to think about. You can do this. Your thoughts impact your feelings, which impact your actions. So if this stuff going through your top 6 inches is positive, optimistic, and focused on those things that count because you're freaking awesome, then it's going to impact your feelings and it's going to make you feel better. Your emotional state is going to rise and you're going to take actions and behave in a way that is more positive. You're going to do things. You're going to have more energy. You're going to find that you're actually able to carry through with stuff. Whereas the fact is, when you have those negative thoughts that are going through your top 6 inches, then you feel like shit. And you've done it to yourself. And then, you know, you walk around, you're like, oh, the sun. And so, yeah, you probably just come back down with me now. But for that moment of what you did in the last 24 hours, that was freaking amazing. You're like, it was this, and you're smiling on your dial and you can feel it again. These are the things we want to do. So when you want to think differently, the first thing, the best thing that you can do is to pause on it and find yourself at that moment in time going, oh, I need to do something here. I need to think differently. I need to do something. Just take the moment, take the pause, just pull back into yourself. Just pull back in that moment and think about what you were saying. What was the intention of what you were saying? Now, sometimes when we say things, it could be in that situation when we're feeling a bit, it could be like, oh, that was sick. Why did you do that? Are you wanting to be sarcastic to that person? Are you wanting to pull them down? Are you wanting to pull yourself down? Are you wanting to get into your little comfort zone because it feels more like you when you're in that situation, even though you might not like it, but it's what you know. Is a little bit freaky to then go out of your comfort zone. But so you're going to go, oh, no, I can't do that. No, I don't do that. No, I can't do that. Oh, no, that's not us. Because you're sabotaging yourself at that point. So when we think differently and we throw it forward and go, you know what? Let's focus on something different here. Because your thoughts are the first thing that you can control. You can control the controllables, and that's your first thing you do is the things that go through your top 6 inches is your thoughts. Now you can do that right here. Is to go, wow, man, this is really cool. Look at that ape. That's really funny. Oh, I love that hand on his head. That just cracks me up. You know, what were you thinking just then? Like, what are you thinking now? What are you thinking about what you're thinking? And so you get more of what you focus on. If you're setting yourself up to go forward with those positives and you're having that run through your top 6 inches, then yes, you are on your merry way to keep more of that. If you have those thoughts that are pulling you down, oh, I'm going to stay back in here in my little comfort zone or my little victim mentality, or just stay down here because, oh, I don't want to look bad, then that's what's going to happen. You have the ability to control this. You have the ability to pause in those moments, and you have the ability to control those controllables. The thing that I would absolutely say to you is to go, you know what, in those moments is to ask yourself the questions of how can I and what would it take? How can I shift? How can I get more out of the situation? How can I change what's going on? What would it take to do things differently? It would take you to think differently and do things differently in your way of life. That's what it would take.
Absolutely. And often what stops us is our opinions of ourselves and the BS that we bring along with everything that we've experienced, the BS that we bring along with all of our experiences in childhood and what we experienced growing up and doing our degrees and working, and that time when that person was like really nasty to me, or that patient just shat on me or complained about me, or any of these things. So all of these things are influenced by where we are right now. And so as we move on to the why of sanity, it's really important to think about where are you in relation to how you respond to yourself. Because if you're wanting to do these steps to thrive and flourish, to build and boost your mental health, to stop that downward spiral, it all starts with you. Okay? It all starts with what you decide to do. Like we said right at the beginning, it's about the decisions that you make determine what happens next, because we're looking at controlling the controllables, me. I can influence out there, but I can't control that. So when you've scanned and noticed, what's happening? When you've called it as is, when you've looked at new ways of doing things, when you've instigated habits, these little short, consistent habits, when you think differently, then you realize and you get to the stage that you understand that you are worth it. Absolutely freaking worth it. Because you wouldn't be here on this planet if not for a reason. You are here for a reason. You are here to give, but also to receive. You are here to be you. You are here to flourish. You are here to be authentic. You are here because you are here. Now you have, some researchers say that you have a 1 in 4 trillion chance of being here on this planet, and you are here. You made it. You, every single one of you on the end of this and who are listening to this. I made it. Christine made it. We had a 1 in 4 trillion chance of being here. That my parents were together at the right time, that this egg and this sperm connected and created me, that I survived the pregnancy, that I was born, that I was created, that I grew through my life. And when we look at how you can maintain and boost your mental health, it is so vitally, amazingly important that you recognize that you are worth it. You are worth taking these pauses. You are worth making these moments in your day to go, how am I? Oh, shit, that was tough. I just had a patient die on me. Fuck, that was tough. What do I need to do? How am I going to get through this? This is the 3rd one this week. This is really, really hard. What do I do now? How can I get through this? What would it take to go to the next step? You are worth taking that time and that space and that pause to go, what can I do next? What do I need to recognize next? Because you are far more valuable to everybody that you come in contact with, if you are not stressed, if you are thriving and healthy, if even you get from being really negative to that neutral, you are far more valuable. And when we get from neutral, it's only a tiny little tip to get to more positive and optimistic. You are so worth investing in what you do and how you do it, and finding a way through all of this to do it differently. We need to recognize how we see ourselves. Do we actually say, oh, yeah, I'll put myself on the list. Yeah, I'm number 73 on my to-do list of look after self. It was lovely to see that you've been going to the gym, you're having a meal, you're experiencing your animals, you're doing different things, you're connecting with people, you're helping other people, because that helps to build your efficacy. It helps to build your authenticity of who you are. We also need to recognize that we need to be vulnerable enough to find out what's actually happening inside. We need to recognize this. And when we say vulnerable, we're not talking about being a blubbering mess. We're not talking about crying everywhere or getting really angry and punching the wall. We're talking about being open and honest and vulnerable. And when we need to say to somebody, you know, I'm really struggling with this. This is the 3rd death I've had this week, and it's actually really tough. I need some help around this. That's about strength and bravery and courage. And that's an amazing way of being your authentic self and recognizing that you are worth it. You are worth investing the time and the money and the ideas and the creativity and anything else that you need to make a difference in your lives going forward. So we've just come through the 6 steps of sanity as we're going through the end. And we've got something for you, so don't go yet. We've got a free gift for you. So you've just come through the 6 steps of sanity and looked at how can you scan and notice. And we said right at the beginning that you can do these things in 2 minutes, 3 minutes, 5 minute stints. There is no excuse. People say, oh, I don't have time. It was like, are you worth it? Answer, yes.
Yes.
Are you worth doing 2 minutes here? Are you worth setting yourself up for 2 minutes or 5 minutes? Are you worthwhile going between tasks before you get on to the next one in your shift? Yes, you are. You are worth it. You're absolutely worth it. Then you call it as is, and you identify where things are realistically at. You don't catastrophize them. You don't ignore them. You don't pretend it's something it's not. And you call it as is. And if you found it scintillating and exciting and cool, then call it as that. Don't play that down either. Recognize that. And you need to understand how to do the new ways of going forward, and recognizing that you can instigate habits on a regular basis going forward and think differently, because you are worth it. And it's not it's not a magic wand. We need to recognize that this is not a magic wand approach. So it's not a quick fix. What it requires is consistent action, because we need to do these things in these 2 minutes, 3 minutes, 5 minute stints every single day. We need to go, hang on, scan, things getting out of hand. Oh, cool, call it as is. In new ways. Okay, what's the new way? How can I do this differently? What's my habit? Okay, I make sure I step outside when I'm feeling overwhelmed, and I look at the sky and I go, and then I go back in and do my job. What are those new habits that you have? What are those new ways that you do? Because it's not a one size fits all. It's not a one booster. This is it. We're wanting to be consistent and keep these things in play, because it's really important to think about how we can maintain our mental health, how we can go upstream, not just be the ambulance at the bottom of the cliff. We're not looking at downstream band-aids. We're looking at how can we do what's upstream? How can we look at what's happening up there so that we can make those changes, we can tweak and change and put these things in place so that we can build and grow our mental health going forward. And in the wonderful, wonderful words of Maya Angelou, who was an American poet, singer, a civil rights activist. And she's published 7 autobiographies and 3 books of essays and several books of poetries. And she was involved in many, many amazing stints for civil rights spanning over 50 years. She died in 2014 at the age of 86, and she has this very wise thing to say. If you don't like something, change it. If you can't change it, change your response. And that's what we've been talking about today, that we can change what's happening up here. We can change the way we respond to something when we are aware of it and we recognize we were at in the beginning of it. We can change it. We change our response. We cannot change the situation. We change our response. Incredibly wise words from Maya Angelou. That is really important to take on board and do every single day. And we want to support you even further.
Yes.
And then we've got time for questions as well at the end. So we're going to have 15 minutes or so of questions. So we want to support you even further. And we've got 3 things that you can take use of. And we're going to pop the links into the, we're going to stop sharing in a minute.
Stop sharing and pop all of the links into the chat box.
We're going to pop the links into the chat box for you. So we have a closed Facebook community because we do this authentic leadership training and development going forward, and we have a closed Facebook group that you may want to be part of. And we do 3-day challenges in there. We put information in there. We give you hints and tools going forward, and people support each other in there. We also have a free ebook for you to download for tonight. And this one is around about engaging willpower to manage stress. Now, when we look at burnout, it's about chronic stress, as we talked about in the beginning. Yep. And so we've got an ebook that you can download, which will overview some of these things and give you some other hints of how to put this in place and remind you what you're doing and how to go forward. We hope you've been taking notes, because it's the only way to learn. However, we don't want to just leave it sitting in information and knowledge. It needs to go to that next level of agency, which is take action. So I'm going to get you to identify those things in a few minutes in the question time. And the other thing that we've done for you for tonight and for next week as well is that we have reduced our coaching sessions. And if there's anything that's come up tonight and you want to talk about this further and have more value in relation to getting more clarity around what you can do and how you can do this going forward, we have got a special offer for you for a coaching session, and we're going to pop the link in the chat box very soon. You can book that online tonight, and we will get in touch with you and book a session over the next 1 to 2 weeks to make it happen for you. So you'll either get Christine or myself, and we will coach you individually, personally, one-on-one through a specific session of what to do and how to do it. So we've reduced that from $750 that we usually charge for a session with us to $197 for you tonight. So that's another way we're going to support you. So we're going to stop sharing.
Put all those into the chat box. That's all.
We're going to stop sharing because we're going to do questions as well. So we're going to put those links in first. And have you got any questions about what we've been sharing about tonight? Please pop them in the chat box. And if you've already put them in before, there were so many comments, we might have missed them. So make sure you re-put them in the chat box. That would be awesome.
That one.
So questions. Questions for tonight. Any questions coming through? Here's the links coming through for you.
So it's Facebook group, then the ebook. Make sure you grab that, and I will pop that one in for you as well.
So any questions about what we've gone through today, how that you are going to take action and do this for yourself because you're worth it? Sanity, 6 steps of sanity, scan and notice, call it as is, new ways, instigate habits, think differently, because you are worth it. Any questions? No questions. Come on, there must be questions. There's always questions.
You say no one can make you think something. What about children who are told by their carers they are useless? a couple of different ways of doing it. You get the little Johnny thing, you know, a self-fulfilling prophecy. Part of it is that not all Johnnies that have been told that they're useless stay useless. So we still have that ability to control. So some of it can be the fact that you can do the thing of, I'm not useless, I can do this, I can do that. And so if we put things in place around that, so it might be, you know, if it's our little tacker and we know that something like that is happening, is that we can talk to little Johnny and go, hey, you know what? Remember all those cool things? You're amazing at this. You can throw your shoes, like you can throw the ball, you can get this, you can do your 12 times tables, all that kind of stuff. And so we're able to turn those things around. And there's lots of different situations where there's people who have been told they're useless, who have been, you know, treated like absolute shite. And yet somehow, somewhere, they find that ability to have hope. They find that ability to be able to turn things around. They find that ability to go, you know what? Do I have to believe that person? Do I have to really, I've done this, I've done that. And it's our different ways of thinking and different ways of looking at stuff. And so it's not like there's a one size fits all answer on that kind of stuff. It's that kind of thing to go, you know what? Is that if we are sitting in any situation, no matter what our age, no matter who we are, in whatever situation we are, if we can find something of that optimistic thing. So if we can think differently, if we've got that ability to go, you know what, might be in this situation and might be shit, but hey, you know what, when I get out of here, I'm going to do this. I can still see that down there, there's those sunflowers, and man, those sunflowers are amazing. Mm-hmm. And when we're able to have those moments that can go tweak, that's the stuff that's going to make the difference for us. So just because one thing happens and they might be told they're useless, but if you can get inside little Johnny's head and keep telling him that he's amazing, and you focus on those things and you celebrate them, and you put those cues and triggers in place, and little Johnny's able to go, you know what? I did those 50 star jumps before and I did really, really good. Like, I was awesome. And I tied my own shoelaces and they didn't come undone. That's pretty awesome. Oh, that person must have something wrong with them. You know, and it's that kind of stuff. Is that, you know, are you able to make light of a situation? Any of those kinds of things, is that there's always a way. There is always a way of changing it and tweaking it.
Awesome. And your questions are coming through, and that's awesome. So make sure that in relation to this whole thing that you're recognizing, if somebody else is putting somebody down, that you also call it out. And you are recognizing and modeling the whole thing of positives. It's like, oh my gosh, I did this really well today. Look what I just did. And so you're modeling that to your team, to your children, to anybody that you're around. And this links into one of the questions, and I'll get to as many questions as we can. It links to the one about somebody who yells at the nurses, a doctor who yells at the nurses. Absolutely disgusting, disgraceful behavior, unacceptable, call it out. Yeah. How can we call that out? What can you do to call that out? Who are your allies? How can you get other people around you to call that out? That is unacceptable. It is bullying, harassment, unacceptable behavior. What can we do? So we can't change them necessarily, but what can I do here? One is I can increase my self-protection, and I can go, that person's an ass. I'm not going to let that be part of who I am. I'm not going to allow that to come past my protection. So that's one thing. We can increase our protection in front of us. We can then go to other people and get our allies on board. And we can say, how can we address this? This is unacceptable. Because you're worth it. Nobody is worth being yelled at. That is not about being worthwhile. That is not about authenticity. That is about somebody shitting on somebody else, and that's unacceptable. So how can we pull together and get other people involved so that we can go, that's unacceptable. So many times I've worked on wards and people go, oh, that's just Dr. So-and-so, that's what they like. That is freaking unacceptable. No. We need to call it out. It's just as bad as people being on a train and somebody being sexually inappropriate to somebody in front of us. No. We need to call it out. Me too. We need to me too it in our workplaces because it's unacceptable. Anyway, that's a rant. I'm going to go on to another question. One of them is negative thoughts come in. How do you break this? And it's like, yeah, you do mindfulness, excellent, fantastic. That's the first place to start because we clear the clutter. So mindfulness is a brilliant place. Mindfulness and meditation is absolutely a brilliant place to start. If you're feeling overwhelmed, and absolutely start with 5 minutes, mindfulness or meditation.
Good
And
work,
then-
Marjorie.
What's this? One next tasty booze, I talk back. yeah, go Marjorie. Exactly, me too. So when negative thoughts come in, we did a whole series on this. Actually, we did a whole seminar. So contact us. We can send you the training that we did on it, and we also did a 5-day challenge in our Facebook group. So you can pop in our Facebook group and you can see some of the stuff around that we do. And so we all have negative thoughts. Every single person. Myself, Christine, every person. And Christine's one of the most optimistic people I know on this planet. Part of that's her culture, part of that's her nature. Part of it is the way she was brought up. Part of it is what she chooses. Absolutely all of that and what she knows. However, we all have negative thoughts. And the secret is that we recognize them, we catch them quick, we put them over there, and we go in a different way. We choose a different reaction. That's the secret. We all get them. We all have them. The secret is to recognize them, go, oh my gosh, it's that thing again. My one used to be, I'm a failure. I ended up in a time in 2002 with absolute burnout. I was severely clinically depressed for more than 3 months, and I could not even get out of bed because I was not good at recognizing my worth. I was not good at putting myself first. I was not good at recognizing the negative thoughts or doing anything about them. And it took me nearly 10 years to get to the stage where I could actually feel good about myself and do things and be creative and identify things and jump into challenges and do things totally differently. It took nearly 10 years to get there. And so what I've learned over this time is to recognize those thoughts. My thing was, I'm a failure. I was a mum of 2 beautiful teenagers in a marriage with working, being a student. I was doing my master's, doing other things outside life, family, extended family, all the rest of it. And it came crashing down because I didn't have the skills of doing what we're talking to you today. And if you instigate these things and recognize these things and then be able to grab them and put them aside, that is the way to go through. It's an awesome way to do it. Somebody's buying a magic wand. I used to work with a psychogeriatrician, and he was amazing. And he would have a bag, it looked like Dr. Livingstone's bag, and he had a magic wand in it. And he used to bring it out to people and go, do you want me to wave my magic wand? And then they'll go, oh, okay. And then they would work with him. It was awesome. Anyway, sidebar. Do you want to talk about this one? Sanity, working with people with depression. The steps of sanity. Yeah.
Two different ways of looking. One of the things I'd say is any of the things that we use in any of the techniques and strategies and things that we use all come from positive psychology. One of the key things that I can absolutely think of right here, right now is Marty Seligman, granddaddy of positive psychology, came up with the whole thing, and he actually uses all of these strategies on people that have got even through to moderate clinical depression. He actually uses it on people that have severe clinical depression as well. He does use some other techniques, but the thing is, and it does work, because what you're doing is you are instigating those new habits and you're triggering those thought pattern shifts. And as we said, it's a continuous thing. When you have the cues, when you have the triggers, and you have those kinds of things in place, all you're doing, and this sounds really simple, and I'm not taking anything away from it, is when you are consistently looking at those thoughts, when you're consistently looking at those ways of approaching things, that becomes the way that the person thinks. Now, when we get into those, the lighter levels of depression, it's those things of we're talking about the way we think becomes a belief. So therefore it impacts the way we act. So that's what we follow through with. And then we end up on this negative downward spiral. Personally, I have this whole thing of there is always a way to change the way you think. Now, it's a choice. And some people are like, whoa, whatever. Yep, sometimes there's the chemical factor of it. Fair call, happy to go on that one. Anything else when it comes to it, for me in those kind of situations, is when you have the ability to get someone to consistently change the way they're thinking. Now, that's set up with cues and triggers. And those are the things to go, you know, what are you thinking about right now? Where are you at? What kind of words are we using? When you role model that stuff, and when you have those people in those situations that are you going, wow, man, look at those flowers. What do you think about when you see those flowers? Let's go stand outside and take a big, deep breath in and then release it out. And then we get all that nice big flood of oxygen. Little tiny things like that are consistently changing the way we think about things. It's our view. It's our perspective. The more we train ourselves, and you can do this, you know, when you keep going on about negative things, of course you feel like shit. You know, when you live in those environments that pull you down, when you hang out with people that pull you down, yeah, that's going to keep you in that circle. When you're able to change those environments a little bit, when you're able to change the way a person consistently thinks. Now I'm talking about consistency here. It's not just those one-off things and you can't wave your magic wand and cure it. It's a consistent thing. You know, are you able to say, okay, let's catch those thoughts? You know, well, this sucks and that sucks and this is useless and I'm useless. Yeah, okay. What'd you do that was really cool in the last 24 hours? They'd be like, what? What do you want about? I didn't do anything. What about that coffee that you had before? What about that meal? What about that shirt that you're wearing? Oh, yeah, I suppose it's this. We've just shifted from negative, go to the garden, eat worms, to neutral. It's okay, it's a shirt. The only meaning we put on anything, nothing has meaning. Nothing in this world has meaning except the meaning we put on it ourselves. Now, if you want to grab hold of the old stories and go, this happened, that happened, you put the meaning on that. Someone else might have had that same shit happen and go, you know what? Yeah, it was shit, but I learned from it. Here's what I took from it. I choose not to get stuck in it. And here's what I'm going to use from that situation to go forward. And these are the kind of things. Yes, sometimes it might sound harsh, but it's calling it as is. What can we do about it? How can I? What would it take? And those are the sort of things to look at. We often get caught up in these situations. Like someone said, you know, what about when people are manipulating you and people emotions and la, 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 la. And I saw you just write it down. No one can make you feel inferior without your approval. No one can make you feel inferior without you in your top 6 inches going, yeah, I'm inferior. Yep, okay, I'll take the blame. I'll feel guilty for that. I'll take the shame.
Now, that may sound really, really tough, and we know that. However, it's absolute fact. Eleanor Roosevelt said it, not us. Eleanor Roosevelt said it first. No one can make me feel inferior without my approval. Huge, huge awakening.
Yep.
And that's why the 6 steps of sanity absolutely works. Because the last bit is about you are worth it. When you recognize that you are enough, that you deserve the good things in life, that you don't deserve to be treated like shit, you deserve to be treated like the professional that you are.
Hell yeah.
You deserve to be treated like humanity that you are. Regardless of any type of diversity, any type of culture, ethnicity, nothing. Absolute, all of that is just whatever. You deserve to be treated with respect. We all do. And so it's really important that you recognize your self-worth, your authenticity and who you truly are, because that comes through with what you do, how you do it, and how you are you with every single person that you touch in a day. Every single person that you meet, every single person, no matter how ill they are, how bullshit they are, no matter how amazing they are, you can take that within every part of you to what you do in a day. Hugely, hugely exciting, because this is part of what you can control up here. And yes, it takes repeat action.
Yep.
And yes, it totally, absolutely works with people with depression, anxiety, PTSD.
Yep.
What was the other one? Oh, burnout. I was like, what was the other thing we're talking about?
thing we're on here for?
Burnout. Absolutely works. There's 3 decades of scientific evidence it works. I am anecdotal proof that it works. Christina's proof that it works. She's changed and grown and developed over the last 10 years as well. Everybody that we work with, they go, oh my gosh, these things are so simple, but they work. I couldn't believe it. And we had one person who came into a program and then she fell out for 9 months and then came back in again later because she said, the things you were telling me were too simple. I don't think they'd work. And then she's like, oh my gosh, these things are so simple, they work. And it was like, yep, we know. She wasn't quite ready to get there. And now she is. Yeah. So that is just so awesome.
So remember that when the key things we're saying here is that you can control the controllables.
Yes.
And it's often that thing to go, hang on a minute, and just roll it up. Just ease up, tiger. Because it's easy to get caught in the spiral. It's easy to get caught in the fluster, and it's easy to get caught in the downward spiral of what's going on out there. It really, really, really is. When we're able to just step aside for a wee bit and go, you know what? What can I do here? What would it take? How can I do things differently? And we're able to just pull back a wee bit. That's when we're going to have a different perspective. We're going to see things slightly differently. While we're doing that at the same time, it's the fact that we're also checking in, because one of the first places to change is you. Now, that will have a massive impact on the people that you're dealing with. Now, I'm sure that every single one of you has had that grumpy ass shitty patient, and you've gone in there, happy as Larry, going, yeehaw, having a cool day, and then all of a sudden they're like, hey, it's not so bad after all, is it? And that's the impact that you can have. That's the impact that you have every single day by being you, by being there, by being present. Now, when you're present enough to scan and notice, when you're able to call things as is, when you instigate those new ways of doing it and you instigate those habits, you think differently. It kind of has that flow-on effect. When you start to ease off, when you start to scan and notice, when you start to call things as is, you get a slightly different perspective on things. And that's as simple as it needs to be. Because then you have new ways that you start implementing. You have new habits that you can then go, you know what, if I set up this, then this will happen and it will change as that ripple effect goes through. Then you start to think differently. And when you start doing that and you go, you know what worked? What I did yesterday worked. Why was it different? Because I actually chose a different way to do it, because I went in with a different intention, because I set myself up and went, you know what, 75% today, so I'm going to give you 75 out of 75. And you were totally present. And when you're doing that, you're realizing that you're worth it, because what you're doing is, instead of just filling up this battery, you're filling up your own. And you're doing that on a consistent daily basis. These little tiny things will help you to get through the next step. You recharge a little bit more. You fill up your cup a little bit more. You can get through the next step and the next step and the next step. And when we do that and we go, what were the really 3 cool things that you did in the last 24 hours? Like, what have you done in the last 24 hours that was friggin' amazing? When you had a smile on your dial, when you saw something happen, when something amazing happened for you, when you experienced something and you went, wow, that was pretty cool. That moment there is the thing that helps you to keep going forward. That moment is when your body goes, I'm going to give you a free hack. And you get the happy chemicals that fly and you're like, yeah. And then if shit happens, you're like, you know what? You said I don't need to deal with you. And you have a different perspective on things. When you do that consistently, you will find you'll be able to get through those things. Yes, all the shit and everything else and the way you've been thinking before is built up in all those years.
Yes.
So you can't change it like this. Magic wand looks cool. You got a little lead weight in the end of it, not suggesting anything here. Just flick me a little text or phone number and address and all that. Happy to help it. Any of that kind of stuff. But you can't just wave that magic wand and go whoosh. It's the consistency of you doing this, and you have to want to do it from in here.
Yes, absolutely.
And you all do that. That's why you do the job you do.
Yes, because you're freaking amazing.
Fucking amazing.
Okay, you are freaking amazing. Okay, so We are wanting to prevent burnout. And if you're partway down that length of chronic trajectory, these are the steps that will take that backwards. These are the steps that will stop it and be able to twist it and move it to a different place. Absolutely, it works. So remember, from all of these things that we've given you, we would love to give you some more value. As we've said, we've put these things in the posts, and here they are again. If you want to recognize and, oops, here we go, take advantage of these things so we can support you further. Remember that it's not the conditions that shape our lives.
Nope.
It's our decisions. And when you make that decision to make those little tweaks, those little changes on a consistent basis, you will absolutely turn this around and thrive and flourish in whatever situation you're in. Thank you so much for being here tonight. Remember, there's another one next Wednesday on resilience from us. If you're wanting to be part of that as well, we would love to see you there. Have an awesome time. Thank you for your lovely comments in here. Thank you for your interaction. And you have been amazing. We just totally, absolutely ask, please take action. Take at least one thing from today and do it differently from here on out. From 8:34 p.m. tonight, or whatever time you are and whatever state you're in, do something different to make it different.
Really.
Whatever state you're in, yeah. Geographical state and physical state. Fantastic. Thank you so much.
Gonna be awesome. Put a smile on your doll. Go and put a smile on someone else's doll. Do something amazing for yourself and keep being awesome.
Yes. Catch you later. Bye.